Today we will be demonstrating a typical visit for an opioid pill count. Pill counts are something we do in our clinic to help ensure our patients are appropriately using their medications and to help keep everyone safe. The patient we will be seeing is Maddie, a 22-year-old woman with severe juvenile rheumatoid arthritis and resulting chronic pain. Maddie is prescribed MS-Contin 15 milligrams twice daily and oxycodone 5 milligrams 3 times daily as needed for pain. Before each pill count, we check the Prescription Drug Monitoring Program, commonly known as the PMP, for any irregularities. The Minnesota PMP includes a listing of all dispensed controlled substances and gabapentin. Prescribers, pharmacists, and delegated staff can and should apply for access to the PMP. We try to time our pill count visits to be approximately mid-prescribing cycle. Maddie receives a 28-day supply of medication at a time and last filled her prescriptions 10 days ago. At that time, she received 56 MS-Contin tablets and 84 oxycodone tablets. So, going into today's visit, she should have an 18-day supply of each remaining. This means she should have 36 MS-Contin tablets and 54 oxycodone tablets remaining. This count may vary by 1 to 2 tablets in either direction, depending on exactly when she picked up the prescription and what she has taken so far today. So we keep that in mind when we're interpreting the pill count. In addition to checking the pill count, we always check the imprint code and physical appearance of the tablet to make sure it is what it is supposed to be. To assist with this, you can check the prescription bottle, which often includes a physical description of the tablet on the label, on the pharmacy label, as well as the imprint code. Also, one can use drug identification programs to help with this, such as Lexicomp, or even just Googling the physical appearance and imprint code of the tablet. That can be helpful, and actually a very quick way to check the identity of the tablet. We do not tell patients that we will be doing a pill count in advance. We give 3 business days notice. If a patient is misusing, diverting, or otherwise not using their medication correctly, then giving advanced notice does not make sense. The National Institutes of Drug Abuse estimates that 21 to 29% of people on chronic opioid therapy misuse their medication in some way. Pill count appointments can also be a very good time to get a urine drug screen if one has not been done in the past 3 months.
Hello, Maddie. This is Irene at your doctor's office. Could you verify your date of birth with me? Thank you. Hey, Maddie, I'm calling you to schedule a pill count for your pain medication. We need you to come in within the next 3 days. If you could please bring all of your pain medicine to the clinic with you, everything in the original bottles, any medicine that you might have in pill boxes. Yeah. Say we need you to come in within the next 3 business days. Yeah, I'm sorry, Maddie, that you feel like this is an inconvenience for you. It's something that we do just to keep everybody safe, and it's part of the pain agreement that you signed with us in order to be prescribed opioids. What's a good time for you to come in the next 3 days? Tomorrow at 1? Very good, we'll see you then. Okay, bye-bye.
Did you bring your pain medication today?
Yeah, here we are.
Excellent, thank you. Is it okay if I take a look?
Yeah, that's okay.
Thanks. Okay. Looks like you have, I see, your MS-Contin and your oxycodone. Great. Before we get started with the pill count, how do you store your medications?
I usually just keep it in a bottle, like just right by my nightstand.
Okay. We do strongly recommend that you keep medicines like these in a locked, safe place, a secure place, because these are medicines that others could potentially steal, or small children could get into them, which could be very dangerous. So you may have some kind of locked cabinet or a lockbox at home that you could keep them in. Do you have something like that?
Yeah, I do.
Great. I'd highly recommend you start storing them there for safety. Now let's talk about how you take your medications. Can you give me details on what time of day and all of that you take them?
Yeah, so for the morphine, I usually take one around like 9 a.m. and then one I guess like 10 p.m. when I go to bed. And then for the oxycodone, I take it when I get up in the morning and then at noon, and then I think like 6 p.m. usually about when I eat dinner.
Okay. Do you ever have days where you take more or less?
Not really, no, but I think I need more oxy, because like if I had another tablet to take at night, I feel like I would sleep better, because sometimes my hands and knees hurt so much that I'm tossing and turning a lot.
Oh, I'm sorry to hear that. Make sure you tell your doctor that when you see her later this month, and I'll let her know as well. All right. When did you last take each of these medications?
Last night, because I was in a hurry this morning, so I didn't have time to take them.
Okay, so around what time last night did you take them?
Like 10 p.m.
Okay, and you haven't taken either one since then?
No.
Okay. Well, let's go ahead and get started with counting them. Let's start with the, let's start with the MS content here. And I'm gonna pour them on this counting tray and we can count them together. And I am checking the imprint code. That definitely is MS content, 15 milligram tablet. And we'll just go ahead and count how many you have here together. 2, 34, 36, and 37. So 37 is exactly right on track, exactly what we would expect you to have left. So I'm just going to make a note of that. And then we'll go ahead and take a look at the oxycodone. Okay. And I see the code on there, looks good. Let's go ahead and count this 2 together. 2, 4, 46, and 48. Okay, so we have 48 left, and Nettie, I expected to see 54 here, but it looks like you have 48.
Huh, I'm not sure why I'm 6 tablets short.
Well, sometimes when people are hurting more, they might take an extra tablet now and then. Do you think that might have happened, or maybe you have a different reason?
Yeah, like I said, my pain's usually worse at night, so yeah, sometimes I wake up because of the pain, and then I'll take an extra one to get back to sleep.
Okay, well, we'll have you see your doctor soon, and you can explain this to her and sort out what might be the best approach to help improve your pain control.
Okay.
Okay, and then I'm just going to take a moment to document this in the computer. Okay, Maddie, I'm going to pack these back in your bag, give them back to you. And I see you're due for a urine drug screen as well. I'm going to have the medical assistant come in to help you get that done.
Oh, okay. I feel like I can't go to the bathroom, though.
Oh, well, I will go get you a couple glasses of water, and you can drink those because we will need to collect a urine specimen before you go. And we're happy to wait until you're able to pee in the cup.
Okay, sounds good.
All right.